I recognize the gentleman from New Jersey, Mr. Kean.
Thank you, Mr. Chairman. New Jersey is a hub of ingenuity in many industries, including in over-the-counter drugs. A number of OTC companies have a strong presence in New Jersey, where they manufacture and they develop their innovative products. Unlike prescription drugs, Americans see these products on store shelves every day and use them for common ailments or to help their kids when they are sick. In fact, many of these products and their active ingredients have been on shelves, in some cases, for decades. But this does not mean that these companies do not innovate. Additions of already approved active ingredients to an existing monograph can increase the effectiveness of a product. Creating a more convenient route of administration for a product can also increase a patient's adherence and therefore their overall health. Enabling innovation is one of the reasons that 5 years ago, Congress, industry, and the FDA worked together to reform the OTC drug approval process. Now we get the opportunity to evaluate these reforms and make any changes needed to ensure that the OTC monograph program continues to foster innovation. Dr. Corrigan-Coure, could you please give us a quick summary of the two distinct approval pathways at FDA that were established 5 years ago in the CARES Act and the difference between the two?
In terms of the OTC monograph, this was really to change from sort of a rulemaking to a regulatory provision. I'm not sure the other approval pathway, I'm sorry, that you're referencing from CARES Act.
Yeah. And then, so I ask this because I've heard concerns from some OTC manufacturers that when they choose the more streamlined pathway, initiate a change to a monograph through OMOR, their concern is that there's a lack of clarity at FDA on what data they need to determine whether a proposed change is a grace, and this leads to more drawn out and back and forth between the FDA and manufacturers that can delay the approval of innovative products. Wouldn't you agree that knowing at the beginning of the process what the guardrails and expectations are for an OMOR can provide certainty to manufacturers and increase their investment in innovative ideas?
Yes, thank you, we would, and we are going to give more clarity. That's one of our objectives in AMUFA 2, to give more clarity about an OMOR where you're bringing a new active ingredient into the market. And we definitely are also going to, across the industry, provide more education on the GRACE standard so it's well understood and our expectations are understood under that standard.
Thank you. Dr. Chen, changing gears here, I wanted to highlight one of the bills that we are considering here today to reauthorize the Title VII Public Health Workforce Programs. I recently heard from the Virtua Health College of Medicine and Life Science from Rowan University that is a recipient of this geriatric workforce enhancement program that is reauthorized in this legislation. Since there are not enough specialists in geriatrics, this college is adapting by working with educational institutions in New Jersey, like Rutgers, and health systems like Hackensack Meridian Health, to educate all members of the healthcare workforce on how to effectively care for New Jersey's aging population. Can you speak to how this effort in New Jersey to broadly educate healthcare providers instead of relying solely on geriatric specialists will continue to help our seniors?
Thank you for your interest, again, I think in the geriatrics programs. In taking care of older adults with complex illnesses, oftentimes multiple chronic conditions, dementia takes a real team. And it takes both the combination, I think, of specialists and people who have been trained to provide that specialized care, as well as the integration with primary care and the wider healthcare system. And that's what the Geriatric Workforce Education Program supports.
Thank you. I yield back.